is Musna from the American Stroke Foundation. When should you see a healthcare provider? If your symptoms impact your ability to do your daily activities, so if you cannot do the stuff you want and need to do, or if you have thoughts of hurting yourself or others, you need to see a healthcare provider or call 911 immediately. You should always see a healthcare provider and reach out to your network if you are feeling not yourself and it's not getting better with the things that usually make it better. But when it has to happen now is when you can't function, when you're not able to keep up with your day, or if you have thoughts of hurting yourself or others. How can caregivers communicate effectively with healthcare providers to ensure the best care for their loved ones? It's always great to have someone else in the room with you when you're with a medical provider because you're there because something is not going well. And so you're already emotionally drained a little bit. And so it can be hard to register all the information you're getting, remember to ask all the questions you need to ask, and feel like you have an understanding of what the next steps are. And after a stroke, there is so much new information to learn. And that's everything from medications to how to move differently, to how to set up disability, what to do with your job. It's a lot. It's a lot for anyone, stroke or no stroke. So if you can have a trusted caregiver in there, that's great. Now, in terms of how a caregiver can support and advocate for you, 100% the professional needs to be looking at the stroke survivor. They are still the patient or the client. I liken it to the situation with an interpreter. When we have an interpreter, too often we look at the interpreter when asking questions or when the person who needs interpreting services is asking questions or answering. But no, the interpreter there is there as the bridge. So when the doctor is talking to you, they need to be talking to you. It doesn't matter if you have aphasia or not. They need to be looking at you, and your caregiver is there to help bridge the communication gap. So one way that your caregiver can advocate for you is to make sure that you're actually being addressed. You're being asked the questions. Your preferences are being acknowledged. One thing that caregivers can do is have a discussion with the person they're caring for before they go into the doctor's office. What is your goal for this doctor's appointment? Are there questions we can write down? When would you like me to jump in with the doctor? But really encouraging that person you're caring for to the extent that they're comfortable to be the active participant in that. And if you have your own questions and stuff as a caregiver, it's always as part of respectful communication important to talk with your stroke survivor before the doctors so the stroke survivor doesn't feel blindsided.